Appreciate it. It's 7:17, and a new report from the Alzheimer's Association shows repeating trends in the growth and burden of the disease.
The annual Facts and Figures report discusses dementia and its impact on individuals, families, communities, the entire health system, and taxpayers. So joining us is the Oregon and Southwest Washington Program Director, Lori Stanton, to talk about the report and some of this year's findings. Good morning.
Good morning.
Thanks for joining us. We want to dig into this annual report. It seems like not a lot of stark differences. We are seeing some trends from recent years really continuing here.
We are, yes. So we have some of our prevalence has really stayed the same, and our local caregiver data has been significantly, I would say, kind of along the same lines.
So what are we doing with this data here? How are we applying this in trying to find an answer and a solution in continuing to treat Alzheimer's?
So this report's really a high-level report, right? This tells us what we need to dive deeper into. So this tells us our statistical information by state. It tells us overall as a nation what we're doing looking at Alzheimer's disease, how Alzheimer's disease is affecting us as a nation, both in costs, caregiving concerns, and in just prevalence overall. And then we were able to narrow that down both to state and to county level. So we can actually look at each county and see the prevalence of Alzheimer's disease.
Yeah, I know cost and caregiving continues to be a huge topic of discussion. What did the report find in terms of that impact, particularly here in our community?
So Oregon specifically, we have over $4.5 billion of total value of unpaid care. So this is care that is provided by families, by friends, by neighbors. This is not the care that you get through an agency. And I think that this is really significant because this is our community coming together and saying we need to care for our own. This is in addition to the cost that is incurred by Medicare and Medicaid. So for Medicaid, which is a state-funded, state and federal funded, the state of Oregon for 2025 had $344 million. And per capita Medicare spending on people with dementia is $26,289.
Wow. Okay, so then what is the next step here when you talk about, people's attitudes toward treatment and medication? What is the next move that needs to happen here with this information?
Yeah, so I think awareness is really huge, right? So not only about the disease and the process of the disease, but also about the medications and treatments that are out there. We have treatments for the first time ever that actually address the underlying biology of the disease. It can address the amyloid plaque that is in the brain. And this is huge in terms of research and in terms of treatment. So I think that this getting the message out there that there is actually treatment available is really big. What's really important about this, though, is that it is for mild cognitive impairment and early stage, and that's why early diagnosis is so important.
Oh, I'm glad you bring that up, Lori, because I wanted to touch on that. And it does seem like public perception and the understanding of the importance of early diagnosis is gaining ground, and really that can be so key in some of our treatment options.
Absolutely. So again, without early diagnosis, we can't access those early treatments. So I really encourage everybody to take advantage of the Medicare Wellness Exam. There's a cognitive testing portion to that. So if you're over age 65, just ask your doc when you go in for your annual visit. Just say, hey, I'd like to try that cognitive testing and get that baseline. That way you can know if there's any sort of differentiation year to year, and that can help you with that early detection piece.
Yeah, some really good
advocate
advice.
For yourself. Ask the question. Lori, really appreciate your time. It's been great to talk to you here this morning.
You guys as well. Thanks so much.
All right, take care. And of course, we're going to post this interview along with the full report in the AM Extra section on our website. That's KOIN.com.
Okay, it is